GV Health is a great place for young people to receive care because we have very, very dedicated and experienced medical and nursing staff working together as a team.
I love working here. It's great to provide care and support to local families during it's a very vulnerable and often very stressful time for them. It's amazing to build that rapport and trust with them.
CAU is a dedicated general pediatric medical and surgical ward. We provide a comprehensive multidisciplinary service to our young people. My major responsibility is to ensure all our patients receive safe and high quality care with compassion while they are staying with us.
I love working in the child and adolescent unit. We can provide the emergency care or the elective surgery care. We're very familiar with a lot of the families in the area. We have a lot of kids in the area with chronic conditions. We also provide support when patients go home, where the nurse can come out to your home 1 or 2 days a week and offer some extra support for those more vulnerable children.
We provide care for children aged from 1 month to 18 years. Receiving care at GV Health allows families to stay local and close to home while still receiving that specialised care. We also have a close relationship with RCH, so we liaise with them as needed. We have a parents' room available. It's a nice spot for them just to take a little break sometime, make it a bit more enjoyable for them, and also a playroom and a playground for children to keep them entertained. They love it out here. It's sometimes hard to get them back into their rooms.
We also have a child life play therapist who interacts with the kids. She's amazing. She does some distraction work with the kids having procedures, provides entertainment for the kids. So a lot of kids have got a lot of preconceived ideas of being in hospital. So Laura spends time with them, teaches them some relaxation techniques. The kids love her. She's very interactive and it's very individual based.
We utilise a family-centred care approach on the ward. We like to keep parents and carers well informed about their child and involve them in decision-making and involve them in care planning. They know their child best, so we lead by them as well as the healthcare professionals.
When my daughter Evie was 8 months old, she fell sick, and it's your first child, you don't know what's going on, and it turns out she was in acute liver failure. GV Health helped us get through all those moments. They've just done so well at caring for her as well as ourselves. The nurses have been fabulous. The same nurses come back to visit her just to make sure she's okay. Hannah and Katie, they are fabulous. She gets the biggest smile when she sees that they're coming into her room. When she first started getting her port flush, she was scared. She didn't like it at all. But now she'll come in, she lays nice and still for them. They just think it's amazing how far she's come as well.
In the child and adolescent unit, if you're going to theatre for a procedure, we've got some little remote cars that some of the smaller kids can go to theatre in.
You can really see a difference in the child from, when they come in unwell to watching them get better and their mood just brightens, and to see them, happy and smiling when they're discharged home is a really good experience.
Having a child who's in hospital, there's always a stress and a burden, but being comfortable and able to come to our hospital that's 5 minutes up the road means me and my husband, one of us can still work or look after my other daughter. You get your private rooms if needed, your own bathroom. It's beautiful, the changes are amazing.